Hello, welcome to MedZone by Dr.farjana Afrin. Today my video lecture topic Flexor and Extensor Retinaculum. In this video lecture I am going to describe about what is retinaculum, the flexor and extensor retinaculum attachment, what are the tendon passes through the flexor and extensor retinaculum, and carpal tunnel with the clinical information related with carpal tunnel syndrome. So let's start. First we have to know what is actually the retinaculum. So, retinaculum, it's a strong fibrous band. So, it's a strong fibrous band. So, here one information we have to remember, it's a fibrous band, and we know fibrous structure means it is connective tissue. Now, if we see connective tissue, more specifically if we see the connective tissue proper, connective tissue proper, the adult connective tissue, we will see there are two forms. One is loose connective tissue, another one is dense connective tissue, and we know the dense connective tissue have more fiber more. Now according to the fiber arrangement, the dense connective tissue can be of two type. One is irregular dense connective tissue, another one is regular dense connective tissue. Now here also we have to remember the fiber types also can be here vary. It can be reticular fiber, it can be collagenous fiber. I am writing in shortcut. So, if there is collection of reticular fiber, we will say dense irregular reticular connective tissue. If there is collagen tissue, then we will say dense irregular collagenous connective tissue. Same in the regular also. Now, our topics is the collagenous irregular dense connective tissue. So, what is retinaculum? The retinaculum is nothing but dense irregular collagenous connective tissue. And which type of collagen? Collagen type 1. That's all about the retinaculum. Now here we will get two type of retinaculum, one on the flexor surface over the wrist and one on the extensor surface over the wrist. So there are two retinaculum here we are going to describe. One is flexor retinaculum, another one is extensor retinaculum. First we are going to say about the flexor retinaculum. Another name of flexor retinaculum we can say transverse carpal ligament. That means it is transversely arranged and it have a connection with the carpal bones. And these carpal bones, when it is attached in the both sides and the underneath there will be a tunnel, and tunnel is osteofibrous tunnel. That's why we are saying it is called carpal tunnel. Let's see on the image. So first things on figure A, think like, and this is figure B. On figure A you can see the connective tissue band look like a wrist band, and that is the flexor retinaculum, and underneath some tendon, some structures are passing. And how this bridge is making, the osteofibrous tunnel, how it is making? Osteofibrous tunnel. The osteofibrous tunnel is actually made because the tunnel is formed above the fibrous connective tissue and below these all are carpals. That's why we are saying osteofibrous. Osteo because carpals are there, bones are there, and fibrous connective tissue is making this band. That's why we are saying it is called osteofibrous tunnel or carpal tunnel. Now, if you see here, we can see here actually flexor and extensor both compartment related retinaculum, but we are first going to describe about the flexor retinaculum. So, this is actually the flexor retinaculum. This flexor retinaculum, it is attached both sides, lateral and medial. First, let's describe which side this is. This is thumb, so of course this should be the lateral side. This is the little finger, so this should be the medial side. Now first we have to know what is the attachment. What is the attachment on both sides? So you can see laterally it is attached with the trapezius. One more also bones will be here attached, that is the scaphoid. So laterally there will be trapezius and scaphoid. And medially we will see hamate and pisiform. Pisiform is not showing in this image, so we can write hook of the hamate and pisiform. This is the attachment on both sides. Now while attaching on the both sides, medially and laterally, you just see here it is forming two slips, superficial and deep slip, and in between one tendon is passing, name of that is called flexor carpi radialis. Similar on the medial side also it will make a superficial slip and cover two important structure, name of that is called ulnar artery and ulnar nerve. Now when this tunnel is extra making on the medial side, name of this tunnel through which ulnar nerve and ulnar artery is passing, we are saying it is called volar carpal ligament. Volar carpal ligament, which is forming this tunnel. Name of this is called the tunnel making ligament, we are saying it is called volar carpal ligament, and name of the tunnel we are saying it is called Gwen's canal. Gwen canal through which what structure is passing? Ulnar artery and ulnar nerve. Now after the attachments on both sides, we have to know about the relation. Relation superficial and relation deep to the carpal tunnel. The flexor retinaculum underneath some structures are passing, they will be the deep relation, and above some structures are passing, that will be the superficial. So let's first start the superficial structure. So superficial structures related with the carpal tunnel or flexor retinaculum. First already we know there is ulnar nerve, then ulnar artery. You can see they are passing above this tunnel. They are passing above this tunnel. Then you also can see there is palmar cutaneous branch of ulnar nerve. Even you can see palmar cutaneous branch of median nerve. So we can write palmar cutaneous, I am writing in shortcut, branch of median nerve, and number 4 palmar cutaneous branch of ulnar nerve. Number 5, you can see one big tendon is passing above the flexor retinaculum or carpal tunnel superficial. Name of that is called palmaris longus. There is one more structure also passing, that is the superficial palmar branch of radial artery. Superficial palmar branch of radial artery. Superficial palmar branch of radial artery. So these are the superficial relation. Superficial relation, or above the carpal tunnel what structures are passing. Now next of course will come what are the deep structure. So what are the deep structures, or underneath this tunnel what are the structure passing? You can see there are 4 slips of flexor digitorum superficialis and 4 slips of flexor digitorum profundus. They are encircled in a common synovial sheath. So what is the name of this sheath? It is called ulnar bursa. Anyway, so first is the flexor digitorum superficialis tendon and flexor digitorum profundus tendon. They are encircled in a common sheath. This blue color is that common sheath which is encircling. Name of that is called ulnar bursa. Ulnar bursa. After that, we are also going to get number 3. Here a muscles which is also encircled in also a fascial sheath. First see what is the name of this? Flexor pollicis longus. Flexor pollicis longus. It will be covered in a sheath. Name of that is called radial bursa. Okay. Then one very important structure is passing. Name of this is, that is under the carpal tunnel. Name of that is called median nerve. Name of this is called median nerve. So number 4, median nerve. This median nerve can compress under this carpal tunnel, and there is a formation of carpal tunnel syndrome. Now I am going to describe about the extensor retinaculum. It is also same like the deep fascia, thickened and form a oblique band over the extensor surface of the wrist area and called extensor retinaculum. So, this extensor retinaculum, it also have attachment. What is the attachment? Same like medial attachment and lateral attachment. It's medially it will be attached with, I am writing in shortcut, medially it is attached with the triquetral and pisiform. Triquetral and pisiform. And laterally it is attached with the, actually it will be attached with the lower part of the anterior border of radius and forming a tunnel. Very interestingly, it's from that fibrous connective tissue septus which is going on both sides, it is attached and it will be moving on the back side, and from here deep septa will be passed inside to connected with the carpal bones, and the whole area is converted into a small some compartment. Total number of compartment you can see here: 1, 2, 3, 4, 5, 6. To total 6 compartment will be here. Let's start from the first compartment. You can see here, I am not writing again, you just see on screen. On first compartment there will be abductor pollicis longus and extensor pollicis brevis. With that, radial artery will be here. It is a point you have to remember. So in first compartment there is an artery, name of that artery is called radial artery. On the second compartment you are going to get extensor carpi radialis longus plus brevis. So, extensor carpi radialis longus and extensor carpi radialis brevis. On the third compartment, you are going to get extensor pollicis longus. On the fourth compartment, two muscle you are going to get 4 digits of the extensor digitorum and extensor indicis. This extensor indicis. On the fifth compartment, you are going to get extensor digiti minimi. Extensor digiti minimi. On the sixth number compartment, you are going to get extensor carpi ulnaris. So, that is all about the 6 compartment, and each compartment what are the structure passing, as I said, from lateral toward the medial side. Now, one clinical topics, that is the carpal tunnel syndrome. If the median nerve is get compressed over the carpal tunnels underneath area, then there will be some symptoms. Together we are saying it is called carpal tunnel syndrome. So, what will be the patient features? There will be burning sensation or pin pricking type of sensation will be along the distribution of the median nerve. Okay, first will be the tingling, or we can say pin pricking sensation. Tingling or pin pricking sensation, where the palmar surface of the hand median nerve distribution. What is that? That will be the lateral 3.5 digit. Then there will be also weakness of the thinner muscle, as it is supplied by the median nerve. Weakness of thinner muscle, I am writing in shortcut. Then there will be ape-thumb deformity. Ape-thumb deformity. And we know there are some signs will be positive. What are that? Tinel's sign will be positive, and there will be also Phalen's test positive. So, that is all about the retinaculum related information along with the clinical information. Thank you for listening.